COVID-19 is leaving behind a world full of grief. Some countries may be emerging from the spread of the virus. Others are in COVID's grip. Some are going into lockdown. And many people, scientists included, are asking why the pandemic wasn't better contained. Dr. Tom Frieden has worked to end epidemics. Frieden is the former director of the Centers for Disease Control and Prevention.
We may never know whether COVID could have been stopped, but there's something really important to understand, which is that every day around the world, public health and healthcare workers are stopping epidemics.
Another deadly coronavirus called MERS appeared in the Middle East nearly a decade ago.
I used to ask people when I was CDC director, remember that big outbreak of MERS we had in the US? And they would look a little puzzled. And they said, no. I said, that's because we didn't have one. We established the ways of testing for it. We alerted clinicians. They did find cases and there was no spread.
Frieden now heads Resolve to Save Lives, an organization that has studied how even poor countries have beaten epidemics. The study cites examples of how countries have stopped epidemics through good leadership, investment in health facilities and health workers, and community involvement. The anthrax bacteria occurs naturally in the soil. It's deadly for animals that graze, unless they're vaccinated against it. Anthrax can also kill people who handle or eat infected meat. In Kenya, volunteers are trained to watch for signs of the disease and to report it. 2 years ago, anthrax broke out in a tribal community. A volunteer reported it, health workers took action, and more than 10,000 animals were vaccinated. An epidemic was stopped in its tracks. During the Ebola epidemic in West Africa that ended 5 years ago, Nigeria was spared because of its polio vaccination program. Health workers already had community connections, and they knew how to do contact tracing and interpret laboratory data.
Using the polio team within Lagos is really one of those success stories that we've looked at how we can amplify.
Nigeria had the Ebola outbreak under control in just 2 months, as opposed to the 2 years it took the 3 other countries. With the right infrastructure, the right leadership, and quick action, Frieden says several epidemics not only can be prevented, but have been prevented. Countries have to work together to prevent the worldwide spread of disease. One thing experts say that COVID-19 has taught us is the world is not ready for the next pandemic, and they say there will be another one. Carol Pearson, VOA News, Washington.